All right, I think we're going to get started. It is 11:03 here on the 23rd of February, and we are very, very excited to be talking about our requests for proposals for the 2023-2024 fiscal year. Before I jump on in, I want to first introduce our teammates. My name is Heather Hollingworth. I am the lead CSS acute care coordinator for the Specialized Services and Supports unit. On this call, we also have Jordan Eller, our manager at the Specialized Services and Support unit. We have Dan Kilmer, who's one of our community services specialists. We have Dee Dee Peters on here, one of our community services specialists. We've got Christy Schaefer, one of our community services specialists. And we should also, because I cannot see, we've got so many great people on this call. We've got Helen Neary, who's another one of the managers for community services. And I believe we also have Rhonda on here, who is our housing specialist. So I'm going to dive on into this lovely request for proposal. One other or two other notes. Please, please, please feel free to put any questions you have in the chat box. We are going to go over them at the very end to make sure that everyone is heard and we give thorough answers. But if you have one, stick it on in there. Also, let's see, is there anything else? No, let's just dive on in and then I'll go ahead and let you guys know more. And then also this presentation will be, we're going to put it in the chat at the very, very end. All right, guys. So every year we have money that is allotted to us to create special new projects. And this year we have a big amount of them that we are looking for assistance with. So we have one enhanced behavioral support home, one residential facility for the elderly. We've got FMS or financial management services. We've got an out-of-home respite service opportunity. We're looking for a psychiatrist. We're also looking for outpatient substance use, a substance use disorder treatment center. We're looking for some more housing access services for out of area, as well as enhanced supported living services. I want to make note that proposals must be submitted by could be submitted by an individual, a group of individuals, or an agency. And then the applicant must have relevant experience, which we're going to be talking about below, with not only persons with developmental disabilities, but also have experience in whichever area you are going to be applying for. And again, that is below. All submissions must go through the RFP email box, which is rfp@altaregional.org. And it must include all the required sections outlined in Part 3. Again, please feel free. We're going to have this sent to you guys or put in the chat. It will also be online later on, hopefully today, on our website at altaregional.org, so that you can have this, or anyone else that is interested can have this. As you know, in the past, you had to attend this orientation to go ahead and submit your proposal. This year, we are not doing that. So again, this will be in the chat as well as online, but all proposals must be submitted to the email box. We are not going to take any hard copies of the proposal. And your proposal must be in no later than Wednesday, March 20th at 3 p.m. And after that, we are not going to be able to receive any of these proposals. After you send in your proposal, you will get email confirmation that the proposal that it is in and ready to be reviewed. So I'm going to go ahead and I'm going to send it over to Dan Kilmer to talk about our enhanced behavioral support home. Thank you guys for attending.
Actually, Dee Dee's going to take this one on, and then I'll do the next one. Yeah.
All right, perfect. Thanks. Go ahead, go for it, Dee Dee.
Okay, we're looking for one enhanced behavioral support home, or we're going to refer to them by EBSH. You know we love acronyms here. We're looking for an HDO who will own the house and do the renovations. And then we also are looking for the provider. So we need both for this one proposal. The rates are negotiated. They are two separate rates, which is facility and individual rates. The minimum staffing requirements is one DSP and one lead 24/7, plus additional staffing based on client need. And there is a minimum requirement of 12 hours per client per month. This will be a 4-bed facility to provide services for clients with high-level needs, behavioral and mental health support needs, and also may require nursing supports. Clients admitted to this EBSH will be exiting out of community crisis homes, IMD step-down, STAR facilities, or individuals who are in jail. This facility can also be used for deflecting clients out of a more restrictive setting. Clients identified for this EBSH may be required of the following. I just went through the different transitions, and then also we'll have severe behaviors, including but not limited to verbal and physical aggression, property destruction, restrictive to daily routines, self-injurious behaviors, maladaptive sexual behaviors, and AWOL. They also might have mental illness requirement treatments and you would need to collaborate with mental health care professionals, and clients might have restricted healthcare conditions. The scope of service would be client outcomes include but are not limited to improving ADLs, independent living skills, and reduction and elimination of interfering behaviors with the expectation that clients could move on to a less restrictive setting. Eligibility of applicant must demonstrate a strong understanding of the challenging exhibited by the targeted client population and types of renovations that must be made to the property in order to best serve the client population, have a thorough understanding of Title 17 regulations for an EBSH, be able to work collaboratively with the housing organization during the development phase of this project, and complete the project in a timely manner. Expectations of the service provider. Direct service hours that must meet the following criteria. 1, administrator on site at least 40 hours per week and provide periodic check-ins on weekends and night shifts. 2, all staff must be awake and on duty all 24 hours of the day. 3, create and maintain systems to ensure quality of the program and adhere to all Title 17, 22, and DDS directives. All staff will be required to become a registered behavior technician certification within 60 days for leads and within 12 months for DSPs. Applicant must have a behavior management system that clearly and accurately identifies interfering behavior, strong data tracking, and a system in place to ensure fidelity of this behavior management program. This home will be expected to work closely with a qualified behavior modification professional or QBMP, a client psychiatrist, and other medical and mental health service providers to address clients' mental health needs. That's the description of our EBSH.
Well, thank you, Dee Dee. Okay, so the next project, we are looking for a new residential facility for the elderly, so an RCFE. Again, we love our acronyms. There's more acronyms coming too. So startup funding is $200,000 for the startup. And this will be, currently we're looking at this being a level 4I facility. Let's see the target population. So obviously it's male, female, 60 and over. We're looking at the focus on more the medical care. So we're looking at clients who are currently in skilled nursing facilities, so a SNF. Either assisted living or the independent living or ILS, and they have nursing care supports. So we're looking at clients who have total care with their physical assistance and their ADLs, hygiene. So they may have ambulation difficulties or be in a wheelchair, physical limitations, sensory issues, visual impairments. They will need assistance with self-administration of their medications, and they will need assistance with arranging their medical and dental care, and may have mild to moderate behavior challenges. See, they may have restricted health conditions at the defined in Title 22. See, clients living in this RCFE. So we're looking at this one having the waiver for dementia and hospice care, right? So you would need to design the program around clients who may have those conditions. Let's see. Okay, so for the scope of service, so So we're looking at the outcomes, including, improving their ADLs and independent living skills, help with monitoring and maintaining their health conditions. So these plans will come in with nursing care plans that will need to be monitored, reviewed, updated as necessary. To ensure client participation in a variety of integrated and age-appropriate activities which take place in a normal environment, at home or in the community. Let's see. And the provider will develop a schedule of activities for clients who are not in or they are not in day programs and choose to stay home. So let's see. So for the eligibility of the client, so the applicant must have a strong understanding of the aging population who also have a developmental have DD. The applicant should demonstrate success with serving clients with healthcare needs, creation and implementation of individualized healthcare plans. Let's see, and have the ability to successfully work collaboratively with others in a multi-agency interdisciplinary configuration. So with other regional centers, the mental health system, healthcare systems, any consultants such as a dietitian, registered nurse, maybe other day programs that the clients are attending. Yeah. Okay. So the expectations. So currently we're looking at a level 4I. So you would have to meet the minimum standard staffing for level 4I. At least one awake staff during the night. The admin should be on site at least 40 hours a week. The administrator should also provide periodic checks on the weekend and night shifts. The home will create and maintain systems to ensure quality of the program and adhere to, of course, Title 17, 22, and any DDS directives. This home will consult with an RN regarding client-specific medical issues and facilitate necessary staff training. So we see this home having a lot of nursing support to monitor the client's nursing care plans, and then also provide that training to the staff and oversee the documentation. Let's see, the consultants that we're looking for include, but are not limited to, a recreational therapist, dietitian, a BCBA, and the home should have highly trained staff who are equipped to meet both the medical and the behavioral needs of the clients. All right, I think I will turn this over to Helen for the next project.
Oh, thank you, Dan. Good morning, everyone. So part of the CRDP project that was approved for this year is the financial management services. So ALTA is looking for applicants' proposals for financial management services for our self-determination program, and also FMS for the participant-directed services. So for those of you that are not very familiar with the financial management services, there are 3 for the self-determination program, 3 service codes under it, and then for the participant-directed services, there are 2 service codes underneath it. And and we will discuss, I think, towards the latter part of this description. So financial management services provider, we're looking for it to provide support to regional center clients who receive services through the self-determination program and the participant-directed services. And the target population of these service are those individuals that are served by our regional center who are transitioning to the self-determination program from traditional services. And the clients that are served, that may also include those that are currently receiving SDP. So the ones transitioning to SDP or the ones that are receiving SDP right now, self-determination program and who may want a new FMS provider. So if they have an existing FMS, but they want a new FMS, so those are the target population of this program. And the scope of service for service provider, a financial management service supports SDP participants to manage their individual budget and pay for services, assist with hiring employees, ensure that providers are qualified to deliver services, and help providers to get criminal background checks as needed. And so for the self-determination program, I mentioned earlier that there are FMS for as bill payer. All they do is pay bills. Participant and FMS as co-employer. The participant of the SDP, the team, and the FMS are both responsible for hiring employees. Participant as sole employer, but the FMS agency can help assist that participant in some of the activities like background checks that are needed for the employees of that participant. And it wasn't included here, but we're also looking for FMS for participant-directed services. And the participant-directed services are those clients that need, let's say, a respite worker, but they want to, not, I'm sorry, that's a
Trying to get the
bad
sound
example.
up.
So the participant-directed services are FMS for daycare services, family vendor transportation, those are, and also respite. And those are service code 490 and 491, which we can provide more details if for whoever is interested in the FMS. The applicant should have knowledge of financial management and can be vendored with the regional center. The applicant, if applicable, should be in good standing with other regional centers for the information of the public. A lot of the financial management services work with many different regional centers. And we do what we call the courtesy vendorization. There's one vendoring regional center and all the other regional centers are user regional centers. The applicant should be able to provide
Mute too.
The volume supposedly is all the way up already.
proof of understanding funds, a bond for clients who they will be serving, at least 20% of all individual budgets. The participant, the applicant must demonstrate understanding of the target client population and should have a history working with individuals with developmental disabilities. The applicant should also have a working knowledge of the Title 17 regulations, California labor laws, and the present California electronic visit verification system that is managed through the Department of Developmental Services. And for the expectation of the service provider or the applicant that we're looking for, the FMS service provider must be able to work with a diverse group of individuals and have effective communication skills. They will be expected to collaborate with ALTA, case management, and provide prompt payments to the identified providers. So that's the financial management services. All right. So the next one is, we call it an out-of-home respite, but this is not an overnight respite facility. This is a day respite facility. We're trying to serve, or this grant, not grant, it's a CRDP funding We have a total of $150,000 for this. It's service code 868, and we're targeting 10 children for this grant. And it's a negotiated rate. The administrator plus one direct support professional per 3 children is the ratio. So this is an after-hours center-based out-of-home respite for up to 10 children at a time. So, and the target population of this project are those are ages between the age of 5 to 12 years old, Russian primarily, Russian or Spanish-speaking participants, or those who are part of Russian or Hispanic community. That is the target population. If we find like 10 children of this descent, Russian or Hispanic or Spanish-speaking family, then their priority. However, if the facility cannot fill the with those population, then it will be open to other populations as well. We're looking for those with intellectual and developmental disabilities. They can be ambulatory or non-ambulatory. Incontinence is accepted, but not total care at this time. Mild behaviors accepted. Okay. This provider or the applicant that we're looking for this program will ensure full staff engagement with the children that they are serving, including the enrichment activities they provide. The enrichment activities will be educational and may include, but are not limited to, like social skills training, cultural education and expression, literacy, arts and crafts, music, social recreation, meal preparation, cooking classes, among other activities to enhance the development of the children in the program. The applicant that we're looking for must demonstrate understanding of the target client population. That's very important, of course. They must be bilingual or have the ability to speak English and either Russian or Spanish fluently. Must have experience as an owner or administrator of an in-home respite agency, a child daycare agency, a day program, or personal assistant agency. Must have knowledge of Title 17 regulations, of course, regarding respite services. Must be available to supervise out-of-home respite program during the operating hours. And so Monday or whatever the agreed days that the applicant will operate, and Saturdays as well. Expectation of the service provider. We want the applicant to be bilingual and able to speak Spanish or Russian and have direct involvement within these communities and cultures. That would be the ideal candidate. Direct service hours that must meet the following criteria. Administrator on site during program hours. All staff should be bilingual and speak English in either Spanish or Russian. Have experience working with children and be trained in childhood education practices. Experience serving the intellectual and developmental disabilities population. Practical knowledge of health and safety practices. CPR and first aid certified. Be fingerprinted and background checked. And they should create and maintain systems to ensure quality of the program and adhere to all of the Title 17, Title 22, and DDS directives. So those are for the out-of-home respite center-based facility, right? And turning it over to the next person.
Me, thank you, Helen.
Oh,
Dan, do you want to do it? Go for it.
yeah, I think I had this one on my list. Yeah.
Go for it.
Okay. Okay, so Alta is looking for a new psychiatrist to be vendor directly with the regional center. So let's see here. We're looking at clients who have a co-occurring mental health disorder who require psychiatric services that are not funded through insurance or other generic services. So the scope of service will be to conduct comprehensive assessments, evaluations, and diagnoses. Develop a treatment plan based on the comprehensive prescribe psychiatric medications and monitor clients' responses to those medications, adjusting medications as necessary. And then we expect this provider to collaborate with the client's planning team as needed to ensure proper implementation of those treatment plans. Provide education to clients, families, and any other support persons. Let's see. So for the eligibility, it must have a current license to provide psychiatric services and be in good standing with the board. And we're looking for this vendor to can be either an individual psychiatrist or belong to a group practice or agency. Okay, and the expectations, develop quality comprehensive assessments, work closely and collaboratively with the client's planning team, develop and distribute reports in a timely manner, adhere to evidence and evidence-based and best practices related to psychiatric services, and may coordinate care with clients' support teams. So that could be other professional consultants, home administrators, staff, physicians, doctors, etc. Okay. All right, Heather, you're up.
Alrighty.
Yeah.
So the next thing we're looking at is outpatient substance use disorder treatments. So we have a need for the Department of Healthcare Services licensed outpatient substance use disorder treatment service for individuals with DD and served by Alta Regional. These services must utilize evidence-based practices. Services are to be performed and are to include, but are not limited to, relapse prevention, treatment, and recovery. And this program would also be serving individuals who do not have a primary substance abuse issue or may have, or who do not have a primary substance abuse issue upon exiting a state developmental center, but who may have a history of suggestive propensity to use substances when they are stressed. Clients identified or the target population as having a substance use disorder and requiring ongoing treatment, outpatient treatment. Clients may be court ordered for a SUD or substance use disorder treatment program through diversion or a restoration plan requiring SUD treatment. The scope of our service provider that we're looking for, we're hoping that services can be delivered to include, but are not limited to, intake and assessment, individual treatment sessions, group sessions, treatment planning, discharge planning, home visits, and consultation services to the regional center clients and their support team. But please note that we hope that our clients, or they will, first access services through drug medical before Alta will step in to support and fund these services. So for the eligibility of the applicant, they must have a substance use disorder treatment program licensed through the Department of Healthcare Services, have the ability and the knowledge to support individuals with developmental disabilities who also have substance use disorder concerns. The expectations of the service provider is to maintain its license with the Department of Healthcare Services and remain in good standing. Also, that they need to, of course, become vendored with Alta and have the knowledge or acquire the knowledge and training to serve and support individuals with developmental disabilities, as well as receive recovery support needs through this. All right, so next, I'm going to send it back over to Dan.
All right. Okay, so the next project we're looking at for a new provider is Housing Access Services. So we currently have a provider we're looking at for a second one. we're trying to develop this to reach out to our individuals, our clients that are in more rural outlying areas. So as you know, we have 10 counties, and we, from Sacramento all the way out to South Lake Tahoe, right? So we have a wide area. We're looking at this provider of this service to reach out to those outlying areas. So I'm not going to read this entire thing. It's quite lengthy. I will highlight some of the points on here, and then whoever is going to apply for this can read this thoroughly when you're writing your proposal. But we're looking at this provider again to help secure affordable housing for our individuals. Again, this is for rural and outlying areas is where we're targeting for this project. So we're looking at clients who have challenges with obtaining, securing, and maintaining housing. The scope of the service for the provider will be, is available for offering housing access services so must have an office, right? So that's where they're going to conduct business, offer training, and must be in our catchment area. And ongoing funding will be provided using the, it's a newer service code, 089. Okay, so there's kind of three components to housing access services. The first is the individual housing transition services. So this is helping clients to acquire housing, all right? And so in here, we're asking a provider to assess the client's housing support needs and barriers to that. Housing search, looking for housing vouchers, securing those. And then there's helping our clients get connected to getting their utilities set up. And there's one of the prongs of the service is crisis, or the housing support crisis plan. So if a client is in jeopardy of eviction, then we would elevate that to a higher level, and so they can maintain their housing and not get evicted. The last prong of the service is maintaining their housing. So once they're in housing, we can use housing access services to help them maintain it. A lot of times there's issues with like landlords where our clients don't know how to manage or handle those situations. So this provider can kind of partner with the client to resolve any kind of concerns or issues with the landlord. Let's see here. Let's see, I'm not gonna touch on everything, but helping them with their landlords, any disputes that might be there, they can come in and help mitigate that. With housing vouchers, I know when they have to recertify those, to help our clients maintain their housing vouchers, and also to help keep their unit or housing maintained, right? So I know in some cases there's annual visits from the landlord, so housing access services can come in maybe a month before and make sure that the physical environment is still okay. Okay, so whoever is applying for it can read all this. I'm not going to touch on everything. And then on the eligibility, they must demonstrate a strong understanding and demonstrate the ability with securing housing for individuals with DD, especially those with limited incomes. That's important. Applicant must have experience assisting individuals with maintaining placement and avoid eviction. Okay, expectations: have a local office, be vended under the service code 089. And just know that housing access services does not provide payment for room and board. That's the client's responsibility. Let's see here. It says here, so persons receiving Health Home or California Community Transition Services will not receive this service unless additional housing access through the waiver is necessary. That'd be a duplication of service. So these other entities provide that same service. So if clients are receiving support through the Health Homes and California community transition services, then we would need a waiver if we're going to use the housing access services. And that is it. We'll turn it over to Christy Schaefer.
Hi, good morning. Okay, so this project type is residential for enhanced deflection SLS. The startup funding is $50,000. The description of the project is enhanced deflection supported living services are for clients who have complex support needs, medical and behavioral, that desire to live in their own home and benefit from living in an independent or unlicensed living environment. The target population, clients are identified for this enhanced SLS service to may have or require the following: an intellectual disability or developmental disability and complex support needs, which may include severe behaviors, including but not limited to verbal and physical aggression, property destruction, resistive to daily routine, self-injurious behaviors, maladaptive sexual behaviors, drug and alcohol issues, and elopement, and possible forensic issues. Significant mental health support needs that require treatment and collaboration with a mental health professional to assist with client stability. Clients may have restricted healthcare conditions that require continued nursing consultation and oversight. And they may be transitioning from a community crisis home, IMD step down, STAR facilities, or individuals that are transitioning from jail or other restrictive settings. The scope of the service for the service provider. The Enhanced Support Living Services, so SLS provider, will provide a broad range of services for adult clients with developmental disabilities. And so some of the services that would be provided include assistance with selecting and moving into a home, choosing a personal attendant and housemates, acquiring household furnishings, common daily living activities and emergencies, becoming a participating member in community life, and managing personal financial affairs. The startup funds would be used to help provide specialized training to a new or existing SLS vendor to train and recruit staff with extensive experience in supporting individuals with ID and developmental disabilities and complex support needs. The eligibility of the applicant, they must have a new or existing SLS agency, must demonstrate understanding of the challenges exhibited by the target population, have a thorough understanding of Title 17 regulations for SLS, must be in good standing with Alta California Regional Center and other regional centers. So the expectation of the service provider is to provide specialized training in order to train and recruit staff who will serve the target population for the purpose of enhanced SLS services. So this training will include documentation, advocacy, crisis intervention training such as PROACT, community safety, reporting regulations, identifying generic resources, information on the Lanterman Act, principles of supported living. Okay, so I'm going to review part 2 of the applicant criterion and RFP process. So the purpose of the Community Placement Plan, or CPP, and the Community Resource Development Plan, CRDP, are designed to assist in the development of necessary community resources for clients who are ready to transition from a state developmental center, SDC, or an Institute of Mental Disease, IMD, or other highly restrictive settings into the community, or to assist those who are at risk of moving into one of those placements. The CPP and CRDP are also designed to develop resources for unmet and undermet needs. Alta California Regional Center solicits community through the request of proposal to seek out qualified providers who are able and willing to meet the specialized needs of this population. Expectations of the selected applicant. It is expected that the selected applicant would work collaboratively and closely with the regional center to provide careful and thorough planning in all aspects of the project, work diligently to complete the project in a timely manner, commit to providing quality services, submit updates and summaries detailing progress made towards meeting the project objectives, and report any major delays with the project immediately to Alta California Regional Center. ACRC will communicate regularly with the selected applicant, licensing certification agencies such as Community Care Licensing, the Department of Developmental Services, DDS, and other stakeholders who have an interest in the development of the project. Through this RFP process, an applicant must demonstrate strength in the areas of clinical, administrative, and financial responsibility. The selected provider must complete a DS 1891 and have no exclusions prior to being awarded a project. Referrals. Client referrals are initiated through the Specialized Services and Support Unit, appropriate interdisciplinary teams, and/or client planning teams. For clients transitioning from an SDC or IMD, the respective agencies, Porterville Developmental Center, College Hospital, etc. Those representatives from those agencies will be involved until the transition to the community is completed. Written proposal. Proposals submitted in response to this RFP are intended to be an overview of the applicant's expected delivery of service for the targeted client population. A more detailed description of the prospective service plan and program design will be developed during the vendorization process. Proposals must be written in a professional manner and clearly reflect the applicant's intended delivery of service. The selection process. The selection committee will review and score all proposals using a 100-point scale. Top points are given to various sections of your proposal that reflect the appropriate supports and services offered to the individuals you're planning to serve. The top 3 applicants with an average proposal score of 70% or above will be interviewed. Alta California Regional Center reserves the right to interview other applicants who may not be in the top 3 or have a score below 70%. The RFP timeline. So the RFP timeline, so today is the orientation, so February 23rd for the RFP orientation, and the proposals are due on March 20th at 3 p.m. And then we will be reading and scoring the proposals and scheduling interviews April 15th through the 19th. And then we will have a final selection on April 22nd. And then the contracts will be signed on or before June 30th, 2024. Startup funding. Startup funding is available for these projects. Funds are meant to aid in the development of the project, but may not cover the entire cost. The selected applicant is responsible for costs that exceed the available startup funds. The selected applicant will complete a startup funds allocation, detailing how the funds will be used. Prior to any disbursement of the funds, the startup funds allocation must be approved by Alta California Regional Center. Vendorization. Selected applicant must acquire and maintain all appropriate licenses and certifications for the program and services and/or the individuals operating and providing the services which are required to operate the program or service. A selected provider will become vendored under Service Code 999, which are startup funds, and then become vendored under the appropriate service code for the program. Selected applicant will complete all requirements to become vendored, include completion of Alta California Regional Center's vendor training applicable to the service. So this will include vendor orientation, behavior management, a program design workshop, medication training, P&I training, record keeping, SIR, and e-billing training. Prior to vendorization, the selected applicant must have an approved program design and cost data worksheet and have signed the service program agreement with Alta California Regional Center. The RCFE Level 4I will be licensed by Community Care Licensing and vendored by ACRC. The selected applicant must adhere to all requirements outlined in Title 17, Title 22, and the Welfare Institution Codes. The EBSH will require DDS approval of the program plan and facility rate, which is known as the CS 6023, and DDS program certification. The selected applicant must adhere to all requirements outlined in Title 17, Title 22, and the Welfare and Institution Codes. Non-discrimination. Alta California Regional Center shall not discriminate in the selection of an applicant on basis of race, color, creed, national origin, ancestry, sex, marital status, disability, religious or political affiliation, age, or sexual orientation. Okay, thank you.
All right, and just to mention quickly, the Alta contacts that you can contact. So of course, the RFP box, so rfp@altaregional.org is one that you can always submit questions to after this. And then you can also contact Dan Kilmer, Dee Dee, myself, Christy, and Jordan Eller if you have any further questions.
Okay. Okay, so this is the last part of the RFP handout, but this is the proposal guidelines. So this is going to give you the outline that you need to write your proposal. Okay, so when drafting your proposal, you need to consider how you will effectively meet the unique needs of the targeted client population. So you would have to go back to part 1 and the product that you're applying for and look at the types of clients that we want to support in each of those programs and gear your proposal towards the needs of those individuals. So draw on any of your experience, any kind of education, and be creative with it too when deciding what services and supports are necessary that you want to propose. Okay, so thoughtfully consider how services will be delivered and considered how your proposal will stand out from others, right? So simple generic responses or descriptions will hinder your chances of being considered for an interview. Yeah, so kind of use this time to kind of think outside the box in some way. And, you know, a lot of these clients do have unique needs and we want to have that reflected in your proposal. Okay, the program summary is not meant to highlight every aspect of the program. A full description of the program will be developed in the program design by the selected applicant. So if you submit a 100-page program design, it will not be reviewed, right? I think we limit the program summary to 15 pages. If you go into 16 pages, I think we'll be okay with it. We just don't want a 100-page program design, right? Those days are over. And trust me, I've done that before and it takes a long time. Okay, so there's 5 different outlines. So find the respective outline for the project that you are wanting to apply for and write your proposal based on that outline. So each one will have a title page, right? That's attached to this handout. We want to know about you and your agency. So anything, I mean, it doesn't have to be related to the product that you're applying for. We just want to know about you and your agency and all the different types of services that you provide. No more than 2 pages. And then we do score. So each item has a point total. So this is based on a 100-point scale. So just look at this is how we're scoring these. So the first the first outline is for the EBSH, the RCFE, the respite service, and the SLS program, right? So we tried to make this generic enough to kind of cover those 4 different programs. And then the respite is for children, where the other ones are for adults. So be mindful of that. I know on the program time for item A, there's a subheading I for the SLS, right? So sometimes you'll see a subheading for a specific project that's a little bit different from the other four. So with these, for more the residential and the respite one, we're looking at, describe what your ideal outline design for the home or the property site might look like, any amenities that you would hope to have in there. And let me see here. See, yeah, so what's your plan for finding qualified staff and the different positions that you would hope to have? So the big section here about the quality of care. So how do you plan to ensure that about the quality of care? Let's see here. So any, describe any like plans, whether it's a behavior plan, nursing care plan, restricted healthcare plan, or any other treatment plans. So how do you ensure that those plans are developed and maintained and overseen? Let's see here. So describe your plan to meet the client's community integration needs. For the out-of-home respite service, identify activities that you plan to implement for the children served in this program, including activities that are educational in nature. So a little nuance there for the out-of-home respite. Okay, describe your plan to utilize any specialized licensed or clinical staff. And then also we want to know, many of these programs will have a long list of consultant types that help them provide services, but what are the top two that you would expect to use for your program? And then detail or explain why you chose those two consultants and how you plan to use them. Okay, describe your staff training plan. And then for each, so every proposal will have, the last item here is, what is your plan to serve diverse populations, including but not limited to culturally and linguistically, and provide an example. So all the projects are required to provide detail about meeting the diverse needs of our client. Then for housing access services, so it's a little bit different. Again, we want 2 pages about your agency, and then no more than 15 for your proposal. So describe how you will secure affordable housing. We want to know about your experience you have with county, city programs, agencies that connect clients with affordable housing. How will you support clients in avoiding eviction or who have received eviction notice? Describe other housing-related services you will provide and the number of clients you are able to serve. Let's see, which counties are you able to provide these housing access services in? Again, this is a program that's meant for our more rural outlying areas. So we would expect, counties that are, not Sacramento as well. I mean, this program could serve folks in Sacramento, but we're also looking at outlying areas in particular. And then again, your plan to serving diverse populations right here, and provide an example. And then see, the third one here is for the outpatient substance use disorder treatment. Again, title page, agency information, and then a description of your service right here. No more than 10 pages for this. Talk about your curriculum or curriculums that you plan to use. And then describe how those curriculums or material is designed for individuals with the intellectual disability. So list any credentials and describe the experience of the treatment provider. Let's see, describe how you assess to determine if a client is making reasonable progress in your program. Let's see, and describe any barriers you may have with serving the targeted population. And I would say when you identify those barriers, it'd be also nice to know how you would overcome those barriers as well. And again, you plan to serve diverse populations and give an example.
Oh, shoot. You scared me. Hold on.
Yes. So the psychiatric treatment, title page, agency information. And then for the description of the service, so this is the main body of your proposal. So describe the types of services you can offer. And again, I would refer back to part 1 of the handout that describes each of these services. And that's going to kind of give you an insight on what we're looking for. And then describe any assessment or evaluation tools used for individuals with an intellectual disability and how those tools will be used. See, list the credentials and describe the experience of the treatment provider. Describe how you access or assess and determine if a client is making reasonable progress and which approach and what is the approach to the service if an individual is not making progress or is declining. Describe any barriers you may have with serving the targeted population and how will you overcome those barriers. And again, how you plan to serve diverse populations and provide an example. Okay, and then the FMS, title page, agency information. And then for the description of service, so describe your ability, skills, and knowledge to implement the FMS service. Describe how you plan to assist an adult consumer or family member functioning as an employer or co-employer. List the credentials and describe the experience of the FMS. Right. Describe any barriers you may have with serving this population. And of course, you plan to serve diverse populations and provide an example there. Okay, so we attached for the EBSH, the RCFE, the respite, and SLS only. There's a sample staff schedule that's attached to this handout. The projected ongoing cost. There is a cost data workbook that will be attached here as well. If you are a usual customary, then just provide your fee for services, right? You don't need to do the cost data worksheet. Just provide what your fee schedule is. Your references, the attachment D. This the statement of disclosure, which is attachment E, and then resumes of the folks that are submitting the proposal. Let's see here. Yeah, so there's the title page. Let's see, keep going. I think there is the staff schedule. So when you do the staff schedule, just assume that you're at full capacity and then fill it in. Okay. And then, okay, so the cost data workbook. I'm not sure if we can share that on the screen after this or not, but it will be sent out. And then list your references. And the last attachment is the statement of disclosure. Okay.
Thank you, Dan.
Cool.
And I have just attached this RFP handout into the chat so everyone can go ahead and download from here. A couple of the questions above did ask for this handout. Please note, not only will it be here in the chat that you can download, but it will also be posted to our website. Dan and my team, I believe the best option for the cost data worksheet will be on our website. We'll make sure that is available. If you cannot find it, feel free to email the RFP at altaregional.org or one of the community services specialists that was put in the chat or that's in the handout, and we can definitely go ahead and send you one. So I did see that Dee Dee was graceful enough to go ahead and answer all of the questions that were in the chat, but I'm wondering if there is anything that or Jordan, if you want to stop the recording first, and then we can go ahead and have an open dialogue as to what questions everyone may have.